How does hearing loss affect speech understanding? Imagine trying to listen to a conversation in a crowded room where background noise makes it hard to hear. Now, think about how hearing loss can make that even more difficult. Hearing loss impacts speech understanding mainly by making spoken sounds less clear and harder to access. When hearing is impaired, the brain receives incomplete or distorted sounds, especially in noisy places. This makes it tricky to tell apart different speech sounds, like consonants, which are sharp and quick. Consonants include sounds like P, T, and S, which are key for understanding words. If these sounds are muffled or unclear, words can sound jumbled or different from what they really are. People with hearing loss often find it hard to distinguish speech from background noise. Normally, our ears and brain work together to focus on speech, even in noisy settings. But with hearing loss, this ability is reduced. It becomes harder to pick out what someone is saying when there is music, traffic, or other loud sounds around. This can cause misunderstandings or the need to ask people to repeat themselves often. The type and severity of hearing loss also matter. For example, high-frequency hearing loss affects the ability to hear high-pitched sounds like S, F, and SH. These sounds are important for understanding words clearly. When these sounds are hard to hear, speech can sound less crisp and more muffled. Flat hearing loss across all frequencies makes speech less distinct overall, which can slow down language development in children. For children, hearing loss can delay speech and language skills. If they do not hear sounds properly during critical learning times, they may struggle to develop clear speech. Early detection and intervention, like hearing aids or cochlear implants, help children access sounds better. Speech therapy can also teach them how to produce sounds correctly and improve their communication skills. From a speech therapy point of view, hearing loss affects not just understanding speech but also how people produce it. When someone cannot hear their own voice well, they might speak louder, stretch out sounds, or have trouble pronouncing consonants sharply. This can make their speech less clear and harder for others to understand. Managing hearing loss involves several steps. Getting a hearing assessment early helps identify the problem. Using hearing aids or cochlear implants can amplify sounds and make speech clearer. Speech therapy supports better pronunciation and language skills. Adjusting the environment by reducing background noise can also make a big difference. Learning communication strategies like lip reading or asking for clarification helps improve understanding. In the end, hearing loss disrupts the normal process of listening and speaking. It affects how we understand and produce speech. Addressing hearing loss early and with the right tools helps people communicate more effectively and build stronger connections with others.